Hello, my name is Suresh Vedantham. I'm an interventional radiologist at Washington University in St. Louis, and I'm pleased to present this paper on behalf of my co-authors here, focused on the ATTRACT trial and identifying predictors of clinical outcomes of pharmacomechanical catheter-directed thrombolysis for acute iliofemoral deep vein thrombosis. So patients with acute proximal DVT frequently develop the post-thrombotic syndrome. As you can see on the left, that can result even in venous ulceration. In the ATTRACT multicenter randomized clinical trial, the use of pharmacomechanical catheter-directed thrombolysis was not found to prevent the post-thrombotic syndrome. However, in patients with acute iliofemoral DVT, it did reduce the severity of the post-thrombotic syndrome. However, the average size of the benefit was fairly modest, and so it seems that this form of therapy is helpful for some but not all patients. So the purpose of this study was to determine, can we predict based on patients' baseline presenting features which patients are most likely to benefit from this form of therapy. We conducted a data analysis from the per protocol data set of the ATTRACT trial's iliofemoral DVT subgroup consisting of 381 patients. We performed regression analyses with interaction terms to assess correlations of baseline factors with 24-month clinical outcomes. We examined a number of demographical characteristics, features of a patient's medical history, and features of their index DVT. That included demographical factors such as sex, age, race, ethnicity, whether or not they had a history of hypertension, diabetes, hypercholesterolemia, or previous DVT, whether their DVT episode was provoked, whether it was in the right or left leg, and whether the popliteal vein was involved at the time of diagnosis. We also analyzed on a continuous scale age, body mass index, baseline symptoms as expressed by the Villalta scale score, and the duration of symptoms in days. We examined 24 outcomes, the occurrences of post-thrombotic syndrome, moderate or severe PTS, and venous ulcer, and also looked at the severity of PTS and venous disease-specific. We found that most of these factors were not associated with differential benefit of pharmacomechanical therapy. There were a few factors that were inconsistently associated with differential benefit, namely compressible popliteal vein at baseline seemed to predict less PTS with use of pharmacomechanical therapy, but for none of the other outcomes was that true. Patients with a left-sided DVT seemed to do better with pharmacomechanical therapy on some outcome assessments, but not all. And then patients with a history of previous DVT seemed to do better with pharmacomechanical therapy as well, but again, for some but not all measures. Looking at the results of symptom duration, as you can see on the x-axis of these graphs is the symptom duration in days, and on the y-axis is the probability of developing post-thrombotic syndrome on the left image here, or developing moderate or severe post-thrombotic syndrome on the right. And as you can see, there's really no correlation. On the other hand, when we looked at the severity of symptoms at baseline, we found that as the Villalta score at baseline increased, in other words, as a patient's symptom severity increased, they were more likely to benefit from pharmacomechanical therapy in preventing moderate or severe post-thrombotic syndrome. And as you can see in the graph on the right, when a patient's baseline Villalta was more than about 10, they were more likely to benefit from pharmacomechanical therapy in preventing moderate or severe PTS than patients with lesser symptoms. This also carried through for the continuous assessment of post-thrombotic syndrome severity and for venous disease specific. So overall, we can say that based on the ATTRACT trial, pharmacomechanical therapy yields early and late benefits in iliofemoral DVT patients, but not patients with DVT limited to the veins below the common femoral vein. On average, the early benefits in the first 6 months seem to be larger than the late benefits. Patients over 65 years of age had less benefit and also were more likely to bleed with pharmacomechanical therapy. The new finding here is that a higher baseline severity suggests that pharmacomechanical therapy will be more effective in that patient. And that was reasonably consistent finding across the outcomes that we saw. There were some limitations and strengths of our study. The ATTRACT trial had strong methodological design. We did stratify the randomization, so the iliofemoral subgroup analysis could be stronger in rigor. We only looked at iliofemoral DVT, which was a plus because that's the share of DVT patients for whom lytic therapy is considered most clinically relevant. On the other hand, that reduced our statistical power. This was a post hoc exploratory analysis. It was not pre-specified in our statistical analysis plan. We looked at multiple factors and did not really adjust for multiple testing. And some of these predictive probability plots, we had relatively small numbers at each particular time point. In conclusion, in iliofemoral DVT patients, pharmacomechanical therapy is more effective in patients with more severe clinical presentation, and also perhaps in patients with a previous DVT history. The use of the Villalta scale at baseline may help to standardize that assessment and predict the ultimate results of therapy. And overall, the ATTRACT trial has clarified who should and shouldn't be lysed and will hopefully aid the design of future acute DVT studies. We're very pleased that this study has been published in the Journal of Vascular and Interventional Radiology in October of 2022. And I'd again like to thank my co-authors. Thank you very much.